Hi, welcome back to All Things Home Care. It's time for Ask Dana. If you're recovering from surgery or need long-term care for a chronic illness, or maybe you have a loved one facing a similar situation, you might be interested in in-home services. Home care services range from skilled care provided by a nurse or physical therapist, maybe an occupational therapist as well, to household support such as cleaning, cooking, running errands. Whether you're planning to enlist the help of a home care service agency or hire a personal care aide, knowing what questions to ask can help to ensure that you receive the highest quality of assistance. If you're considering a home health service agency, these are some of the questions you might want to consider asking. Is the agency licensed by the state? Most states, but not all, require agencies to be licensed and reviewed regularly. So check with your state health department. Keep in mind, just because they're sending an aide to your home does not mean that they are licensed. There is a difference between agencies that are licensed by the state of New York or licensed by any other state versus our companion agency that is not licensed. A licensed agency is regulated by Department of Health and goes through regular audits every 3 years. A companion agency has no oversight. Department of Health does not oversee them, and there is no auditing or monitoring of their services. Keep that in mind. Is the agency certified by Medicare to meet federal requirements for health and safety? If not, ask why. What type of employee screening is done? Can an agency provide references? Ask for a list of doctors, hospital discharge planners, and other professionals who have experience with the agency. I know that we deal with a lot of hospitals, we deal with a lot of social work offices in skilled nursing facilities, and we are on the list of providers. I would say that if the agency that you're engaging is on the list of providers from those facilities, you could feel comfortable with the services that they provide. Can the aide provide references from at least 2 employers? Check them thoroughly. I will tell you, as an agency owner, we get references on all of the aides that are employed by us, but I have yet to find anybody give a bad reference. I'm just saying. Maybe ask your or your loved one's own doctors, social worker, hospital discharge planners, and family friends for recommendations. If you're considering a home care service agency, how does that agency train and monitor caregivers? Does the agency provide continuing education? Keep in mind, a licensed agency is required to provide 12 hours of training a year to their employees that are home health aides in order to maintain their certificate. If they're a personal care aide, it's 6 hours of ongoing training. And the training is up to the agency to decide exactly what they want them to learn for 6 of those hours. Are the caregivers licensed, insured, and accredited? Well, most caregivers that are working for agencies are covered under the agency's licensure and their insurance policies. If you're going to be hiring someone privately where you're paying them off the books, I would have to tend to say that there is no insurance and you're basically taking a chance. Do the agency's employees seem friendly and helpful? One of the things that we find a lot of times is that if an aide goes to the home and maybe the aide doesn't speak perfect English, but if they have a nice smile on their face and a positive attitude and that want to help the individual, that sometimes goes a long way. So that first interaction, we call it 51st dates. Sometimes it hits, wonderfully the first time, and sometimes you might have to go through a couple of aides to get the right fit for your loved one. How does the agency handle expenses and billing? Ask for literature explaining all services and fees, as well as the detailed explanation of all costs associated with home care. They should be providing an invoice to you on a weekly or bi-weekly basis and really outlining exactly what hours that aide worked and what you're being billed for. Will agency's fees be covered by health insurance or Medicare? Check to see what kind of coverage your health insurance offers and be sure to understand what criteria Medicare requires. For instance, do they require your loved one to be homebound? You should definitely do some investigation when you're thinking that you can get an aide, a home health aide through Medicare. Traditionally speaking, Medicare does not cover just a home health aide. You will need the services of a skilled nurse or a physical therapist in conjunction with that home health aide. But if you are Medicaid and you are in part of the managed care system, your managed care long-term care provider will let you know what agencies that they work with and exactly what kind of hours that you're entitled to, and they would be the payer for the services. Well, that's all the questions that we have for today. If you have any questions, comments, or maybe a show idea that you'd like to discuss, email me at info@allthingshomecare.org.